Hello everyone, I am Dr. Srikanth Munna, consultant urologist and andrologist from V9 hospitals. We are repeatedly getting questions from patients regarding one special topic, that is interstitial cystitis. So what is interstitial cystitis and how is it different from routine urinary bladder infection? So interstitial cystitis is a technical term which is used for repeated bladder infections or inflammation. There may not be infection in this, it is only inflammation. Infection and inflammation are two different things which are distinguished by presence of a microorganism and absence of a microorganism. So inflammation is a thing which happens when there is redness, when you have some trauma, when you had some accident, the redness which it is caused, it is called as inflammation. So it's a body natural responsive mechanism for any trauma to heal that area. So if the same happens when there is infection also, when there is an organism causing some pus or something infection, the body response happens and the same redness, same swelling, same pain happens in the presence of microorganism which is inflicted and initiated, stimulated by a microorganism. So that is called as infection. So urinary tract or bladder infection is generally incited because of a microorganism entering into the urinary tract. Whereas interstitial cystitis, also termed as bladder pain syndrome, happens even without microorganism, even without infection, even without any inciting cause, because of the hyperexcited autoimmune response of the bladder walls. There are multiple theories stating the causes of interstitial cystitis. It is very difficult to diagnose. It is a diagnosis of exclusion. You need to exclude 20 other causes of this condition so that we can come to this diagnosis. And the treatment part is also very laborious and long taking, and patient may not be 100% satisfied with your doctor even after multiple attempts of treating this problem. So interstitial cystitis happens even without infection, whereas a routine urinary bladder infection is a temporary condition where it happens in the presence of infection. A urinary tract infection can be recurrent or refractory depending upon the strength of the organism compared with the strength of the antibiotic, course of antibiotic, and your bladder habits. Whereas interstitial cystitis, it doesn't require any antibiotic. In the initial phase, when we are confused with the infection, our course of antibiotic generally is prescribed by most of the urologists, including me, because empirical antibiotic therapy once in the first event is mandatory to rule out infection or to treat infection. So if your urine is sterile, there is no infection or urine culture doesn't diagnose any major microflora, and still your urine has pus cells in it, which is called as sterile pyuria, or without pus cells, and you are having continuous pain whenever you are voiding. This is mainly a bladder pain syndrome scenario. So it may be confused with multiple other problems. Most common is urinary infection, and second most common is overactive bladder. So overactive bladder has also mixed symptoms like interstitial cystitis. So majorly they both are differentiated with urge incontinence. So overactive bladder will have frequency, urgency associated with urge incontinence. There may be leak. But in controversy, the interstitial cystitis component will have frequency, urgency similar to overactive bladder, but the third component where urge incontinence is predominant in this overactive bladder, in interstitial cystitis, the patient will be able to hold urine. He doesn't have any incontinence, he or she may not have incontinence, and mostly it is associated with holding of urine, going to bathroom and passing with severe pain. This is the crucial factor which differentiates these two clinically. And coming to the treatment line, a simple urinary bladder infection may be treated with an antibiotics, anti-inflammatories for pain relief, and if there is any overactive bladder component, a bladder relaxant to alleviate the symptoms. Whereas an interstitial cystitis, it requires a wide variety of drugs and which may be approached in a stepwise manner, and it may require sometimes a cystoscopy where we do a camera test within the bladder to see for bladder contour, any inflammatory signs, Hunner's ulcers. There is a special categorization of histopathology mentioned as interstitial cystitis based upon the biopsy report. So it may require a biopsy, or it may require instillation of intravesical drugs. There are 5 lines of therapy there, where in the first line we will be evaluating the patient, educating him for behavioral therapy, lifestyle modifications and all those things. Second line of therapy will come with the drugs, antimuscarinics, okay, bladder relaxants which we use, and some modifying agents, immune modulators, where we instill some medication in the bladder, hold it for 15 to 20 minutes and then urinate, and do this weekly once for 6 weeks initially and 6 months monthly once later on as a maintenance therapy. So basically interstitial cystitis is a long-term problem which happens without a cause, to summarize. Whereas urinary tract or bladder infection is incited with a cause. It may be a diabetes uncontrolled, it may be a bowel habits which are constipation or some loose stools like thing, or it may be a sexually transmitted disease, or it may be because of urinary incontinence where your local hygiene is hampered. All these causes may be evaluated and treated accordingly so that you may not have a urinary tract infection in future. Here in interstitial cystitis, the treatment part is very difficult and you cannot do anything in future not to recur. But yes, you can alleviate the symptoms with medications and lifestyle modification and avoiding few drugs like caffeinated drinks, carbonated drinks and all those, which are bladder chemical irritants. Okay. So these are the main differences between interstitial cystitis, which is also called as bladder pain syndrome, and a simple urinary bladder tract infection. Thank you.